Welcome dear students. Today we are going to see ocular drug delivery system part 3. In part 1 we have just discussed the general anatomy and physiology of the eye. In part 2 we have learned what are the barriers which act during the penetration of the drug through eye. Now in part 3 we will see how we can overcome these barriers by using alternative routes. So the advances in ocular drug delivery systems aims to overcome the barriers which act along the way of drug penetration through the ocular cavity. Okay, so basically there are two major approaches to overcome these barriers. The first one is use of novel routes of drug delivery, and the second one is to develop novel formulations. Now in this particular part 3, we are going to learn only about the use of novel routes of drug delivery system, and in part 4 we will see what are the new formulations, novel formulations developed to overcome these barriers. So what are the various routes? So drug delivery through novel routes for the ocular system. Okay, the first one is intravitreal injection. Now intravitreal means what? Just like IV, intravenous, we give the drug directly into the veins. So in intravitreal injection, the injection is given into the vitreous humor of the eye. Okay, so in intravitreal injection, the drug is directly injected into the vitreous humor of the eye cavity. Now this route is the most invasive route. Now as we are giving the injection directly into the vitreous humor, it is going to overcome the inaccessibility of vitreous humor through the cornea and limit drug loss through scleral blood flow. Now we have seen that when the drug, it has to permeate through the eye, it has to move through the cornea. Now cornea is the major hurdle for drug absorption. Okay, so if we give the injection directly into the vitreous humor, then it will overcome the barrier of the cornea, and also the loss of drug which occurs due to the scleral blood flow, that will be also limited. Okay, so we are going to give the injection directly into the vitreous humor, so its bioavailability will be increased. Now when the drug is administered into the vitreous humor, it can be given into solution form or a suspension form or in this form of depot system. Now what is a depot system? When you deposit a drug, so what is a depot system? When you give a drug into the into any body part, and if it stays there for a long time, then drug release occurs very slowly for a prolonged period of time. Okay, so that is a depot system. So now if you give a drug in the form of a suspension, it will go into that vitreous humor and it will reside there for a long time, and the drug release will be slow for a prolonged period of time. Okay, so in depot system there is no need to give the drug again and again. Okay, so the frequency of administration is reduced, and it is so this type of system, it has high patient compliance. Now once the equilibrium is reached, drug follows the first order kinetics and drug concentration declines. So this depends on the molecular weight of the drug. Now when the depot system is formed, the release is dependent on what is the molecular weight of the drug. Okay, for large molecular weight drugs, they have longer half life, so drug release can occur for um, for weeks to months. Okay, and for small molecular weight drugs, the drug release is can occur up to 3 days. Okay, so for 3 days also the patient, he gets relieved from frequently administering the dose. So how the release kinetics of the drug, it depends on the molecular weight of the drug. Okay, now what is the limitation of this system? After repetitive administration, there is a chance that it might damage the eye. Okay, now how it can damage the eye? There can occur retinal detachment, or it can give rise to cataract or to hyperemia. Okay, so as I told you that it is an invasive method, so So it has to be done very carefully, and it should not be done repetitively to avoid all these complications. So drug is administered. The next is the subconjunctival route. The drug is administered beneath the conjunctival membrane that lines inner surface of the eyelid. Now if you see the eyelid, inside the eyelid, that particular mucosa is the conjunctiva, and if you are going to give the drug, you have to give it below that conjunctiva. Okay, so that is subconjunctival route. Okay, so if you give through this route, then you are circumventing the cornea. Okay, so through conjunctiva. Now conjunctiva is highly rich in blood vessels. Okay, so because of the blood vessels, the drug which goes into the conjunctiva, it moves into the blood vessels and it goes into the systemic circulation. So from there also the drug is lost. Okay, so if you are giving it through the subconjunctival route, then you circumvent the cornea and the conjunctiva. So this particular method is less invasive as compared to the intravitreous method. It allows more drug to move through the sclera and directly enter the vitreous humor. Nanoparticles given through this route can act as depot and minimize the administration frequency. Okay, now if you see this, this is your eyelid, and below this eyelid it is the conjunctiva, and when you give the injection into the lower below the conjunctiva, then it becomes the subconjunctival route. Okay, now in the market we have a drug formulation for Avastin. It is a recombinant monoclonal antibody used against vascular endothelial growth factor, proved to be effective in decreasing degree of neovascularization when it is given by subconjunctival route. Okay, so that is the example of marketed formulation. Now let us see what is the next route, and it is a retrobulbar route. Okay, now what is retrobulbar route? Now retrobulbar means what? You give the injection behind the globe of the eye. Okay, so here the drug is injected through eyelid, and it is placed, and the drug is placed into the retrobulbar space. Okay, now it is used to administer drug at the back of the globe. It is used for drugs like antibiotics, corticosteroids, anesthesia, etc. It is a delicate procedure as there is a risk of damaging to the optic nerve. To avoid damage to the optic nerve, you should not insert the needle beyond 1.5 centimeter. Okay, behind the globe. So if you don't give it for if you don't inject it beyond 1.5 centimeter, then there is no risk of damaging the optic nerve. So the doctors, they have to be very careful. The next route is peribulbar route. Okay, now peri means what? Towards the periphery of the globe. Okay, means to the adjacent part of the globe. So it involves injection above or below the globe. Route of choice for it is the route of choice for anesthesia in cataract surgery. It is found to be much safer and effective route for anesthesia applications during the surgery. Now here also there is a chance of bleeding within or outside the muscle tone after injection. So you have to be careful while administering or while injecting the dose in this case too. The next route is subtenon route. Now what is the subtenon? The drug is administered between the tenon's capsule and sclera. Okay, now this is the sclera and this is the subtenon space. So you have to inject it in between the capsule and the sclera. Now for administering the dose, okay, or the drug or the formulation through this route, you have to use a blunt cannula. You cannot use a sharp one. It is a better route for anesthesia than the retrobulbar and peribulbar route. Steroids in the treatment of oocytes and cytoid macular edema has been shown to be effective. Triamcinolone acetonide, it is mostly administered through this route for pain and scleral inflammation, and it is found to be very effective. And the last route is intracameral route. The delivery of the drug in the anterior chamber by injection is achieved through this route. It is mostly used for treating the diseases or the ailments of the anterior chamber. It is also mostly used for cataract surgery. Dexamethasone, when administered intracamerally, is effective in decreasing post-operative inflammation in glaucomatous and non-glaucomatous patients. It is very cost effective and more efficient method for antibiotic administration. So this was all about what are the alternative routes used for effective drug delivery to the ocular cavity. Now in the next part we will learn about what are the different novel formulations developed for ocular drug delivery to overcome the barriers which act during the penetration of the drug. Okay, so all these efforts, use of different routes, use of novel formulation is done to increase the bioavailability of the drug. Okay, so this was all about the different routes of ocular drug treatment. Okay, so now next in part 4 we will see different formulations. Thank you.